All right, good morning, everybody.
Good morning.
Joining.
Happy New Year, everybody. Welcome. To those of you new, thank you for joining us today. Please turn your cameras on. We want to see those faces this morning. And feel free to utilize the chat. We'll go over a couple of housekeeping items closer to the hour. But for those of you who are new, welcome. Yeah. Mike, are you ready to enlighten us all this morning on benefits liability in the workplace?
You bet. Good morning, Matt and Renee. Yeah, and it's always nice to be asked to share your knowledge. So hopefully leave everybody on the call here this morning with some best practices, how to reduce liability for their organizations.
Perfect. It's 10 o'clock. So again, I want to welcome everybody to Tune In Tuesday, our first one of the year on benefits liability in the workplace. Matt, this is a huge topic. You run into it all the time.
It is, and so many of the things we're going to be talking about today can be resolved or prevented just by being proactive. From having these conversations with your broker, with the carrier, that kind of stuff, and just making sure you have certain things in place before something happens, so it doesn't happen on your watch.
Not on my watch. Go ahead, Maddie. Tell our new viewers a little bit about us.
So we are a firm local with a national reach. We have clients all over the country.
We do. Thank you, everyone.
About 400 years of combined experience, which is a little crazy. And I know, even speaking of experience, Michael, you've been with Blue Cross for what? 12 years 13. Now? 15 years?
Yeah, almost coming up to 13 years. Yeah.
Lucky 13. Love that.
He joined Blue Cross when he was 12.
Yes.
I appreciate that.
Okay, so there's our team, and we could actually still get together.
I know, it's crazy.
Okay. All right, so we're just going to dive right in. So kind of what we want to do is I'll give kind of a perspective, and then Michael can give a perspective from the carrier side. Blue Cross kind of has their own version of a mandatory versus non-mandatory plan, which Michael will get into a little bit, but essentially from our end, making a plan mandatory and not allowing employees to opt in and opt out at will is one of the biggest liability prevention things that you can do. So we'll try to give examples for a lot of things. So here's one right off the top. You allow an employee to opt out. They take the booklet home. They decide, no, I don't want to be part of it. Then unfortunately they pass away.
Oh.
So then the widow looks, oh, there's 2 times life insurance in this booklet, goes back. It is not on the carrier to pay that. It's not on the broker. Where does the liability fall? It falls on the employer. Mike, you had a really good story about that too, did you not?
Yeah, you're right, Matt. And from our perspective, you're right. There are 2 forms of contracts, one being a non-mandatory contract, and then the other being a mandatory contract. So in the example you've used, it's a non-mandatory contract, which means the employer has not made the benefit program a condition of employment and is allowing an employee to opt out. Or in your situation, the employer has done their due diligence. They've provided the enrollment application to the employee, and the employee just simply hasn't returned it to the employer. So in a non-mandatory contract, you're exactly right. If an employee is not enrolled in the benefit plan within 31 days from their effective date of coverage, regardless if it's the employer's fault or if it's the employee's fault, in that situation where the employee was not enrolled, they should have been enrolled, and passes away, the employer could be, looking at a one-time salary or, a flat $25,000 that they'd have to pay out to the beneficiary. So that's significant, knowing, whether you have a non-mandatory or mandatory contract. The alternative to that, and one example I can share with you, Matt, Renee, is we promote mandatory policies where the benefit plan is a condition of employment. So what happens in a non-mandatory plan is that if there's been an employee that should have been enrolled in the plan and just for whatever reasons didn't, we just simply would enroll that employee back to when they should have been enrolled and collect retroactive premiums. So we had an example a few years ago where an employee was provided their enrollment application, didn't return it to the employer. That employee passed away. Received a phone call from the plan administrator, very concerned, of course. We just simply went back to the contract and said, you entered into a mandatory contract with us. Therefore, we will pay the claim. So we paid a claim for an employee that wasn't even enrolled in our system. We didn't have an enrollment application for. Unfortunately, the claim had to be paid to the estate because we didn't have a named beneficiary. But that highlights, a great example of the difference between knowing your contract and do you have a non-mandatory or a mandatory contract.
Okay.
Yeah, it makes an enormous difference. And you get some contracts that allow, say, 75% participation. So that means that 75% of the people need to be enrolled. Well, that is still dangerous, because what do you do if, say, you allow Renee to opt out, then all of a sudden you're right at that 75%.
Oh, wow.
Then the next employee that comes, they're forced to go on, right? So it really removes a lot of the agency from you. So making it mandatory, covering your butt is easily a very, an easy step to do to dodge a lot of that liability. Michael brought up another really good point in there. It's not on the slide, but beneficiaries. This is another very, very easy thing that you guys can have your staff do. Make sure their beneficiaries are up to date. The last thing that they want to have happen is they pass away and the money goes to an ex, right? Or something like that, or not, new relationships, new children. Just making sure it goes to the right place can just save you a lot of problems down the road. Late applicants. So on your typical contract, once you hire a new employee, you have a 3-month waiting period, and then there's a 1-month grace period to add them onto the plan. If it is beyond that, they are deemed a late applicant. So if you go to a mandatory plan, like Michael had talked about, it's as simple, with Blue Cross at least, as just backdating the premium. With most other insurance companies, it is medical questions, and that employee could get fully declined, which then they come to you or then come to us and say, hey, my employee was declined, what do we do? And sometimes we might even have to move to an entirely different insurance company. Anything to add, Michael?
Yeah, and we're so focused, and rightfully so, on enrolling the employee within 31 days from their effective date of coverage, but we also need to be mindful that also extends into dependents as well. So, situation, single employee has now gotten married or has now had a dependent child. Those same eligibility requirements apply to the dependents as well in a non-mandatory situation. So, and I know it can be challenging. If you have a plan administrator, maybe working in Saskatoon with multiple branch offices throughout the province, that could be a challenge when you're not seeing employees face to face. So you really have to ensure that your management team in those locations are aware of some of the requirements to ensure that that spouses are not made late applicants and put through the medical underwriting process. Correct? Yeah.
Yeah, absolutely. And the worst case nightmare scenario, again, someone's declined for coverage and they're sick, and you lose an employee and you're not taking care of them. So again, that's a very easy thing. You can make sure, one thing that we recommend, honestly, is when you're sitting down with a new employee, like a new hire, you have to fill out a bunch of tax paperwork anyway. Have them fill out the benefits form right then and there, even if they don't remember their kids' birthdays or their wife's birthday or whatever, which comes up a lot. Just get it mostly filled out, make sure it's signed, make sure there's a beneficiary. Some of the stuff can be filled in later over the phone, but just avoid having to chase people down to get their applications. Okay. Like Michael had said, dependents, another big one is making sure your salaries are up to date. So if you say give people, your team, a bunch of raises, but you forget to update it in the system and that person goes on disability, the insurer could just look at what is on the system and pay the lower amount. I know there's verification and checks that, like, I know Blue Cross will reach out and say, hey, is this the actual salary, or what were you paying them? How much were they working? That kind of stuff.
Yeah, a few comments there, Matt. So we cannot stress the importance of reporting salary in a timely manner to the insurer. It doesn't matter if you're with Sun Life, Canada Life, Blue Cross. The reporting of earnings is of course important because it calculates premiums for any salary-based benefits and payouts of benefits specific to life insurance, accidental death and dismemberment, short and long-term disability as well. So if salaries aren't reported in a timely manner, you're exactly right. The insurance contracts that I've seen from the industry do allow the insurer to pay on the last reported earnings. So the last reported earnings could either be the claim form at time of a death or a disability, or it could be that, geez, I didn't update the last time I updated our salaries was in 2017, right? So it's the lesser of. So of course, speaking a little bit to Saskatchewan Blue Cross, we certainly are empathetic, in situations where, employee has deceased, or employee is entering a disability claim. So we want to make sure we do what's right. So we do investigate that further with the plan administrator to ensure that that earnings are corrected appropriately. Our mandatory contract again allows us to do that. So just some key tips and some key signals to what might prompt you to report earnings to the insurer could be just yearly increases. So our company implements cost of living increases January 1st of each year. That would be a good time to reach out. Maybe you've had an employee change positions as well, so they've gone from maybe an operational to a management. There generally be a salary increase with that. Maybe the hours of work have changed, so an employee's gone from part-time to full-time. That would generally result, or maybe it could be a change in the pay. So it could be maybe hourly to commission, salary to commission, or maybe T4 income to dividend income. So that would all be good examples of reasons to reach out to your insurer to update earnings, to ensure in the event of a claim that the insurer has the proper earnings recorded for your employees.
Yep, absolutely. And the last, there we go. The last slide on plan eligibility, employee terminations. Now, I know that seems very obvious, but check your bill at least every once in a while, just to make sure you have the right people on there. I have an example of a client. They're around 100 employees. They have about 7 or 8 locations spread across the province, and he hadn't checked his bill in years. So he had an employee that applied for disability, was declined, but that employee told the employer that she was on disability, that she was approved. He didn't check the bill. They paid claims for her for 7 years.
And typically, aren't billing summaries every 30 days?
Yeah, and you can log on to any kind of insurance company portal and you can see them. You can get them digitally.
Okay.
Some of them still mail them out, but on the whole, you can get access to your bill to pretty much whenever. So it's a good practice to double check at least every 6 months or so, or when you're doing your salary updates. That can be something just to make sure all the right people are on there, because this still happens all the time where I'll be talking to a client and they'll be like, oh yeah, these 4 people left, these 3 people joined. It's like, okay, well, you need to actually process that on the website.
Okay.
Yeah, and it's one of those situations, and Matt and Renee, we see monthly reporting where we've seen situations where terminations are backdated, and we're not talking at times hundreds of dollars, we're talking at times thousands of dollars, where an employee has incurred prescription drugs, health practitioners, dental. So terminating employees really shouldn't be, I'll get to it tomorrow. It should be, I should get to it today, because there can be a lot of claims incurred that evening, or the next morning by a terminated employee.
Yeah, we see that all the time with employees leaving. They will make sure they go to the dentist before they leave. We'll say that. That's a good segue, actually, in terminating employees. Oh, so as we've been doing this, we figured out that the poll system is broken today. lovely how technology doesn't work. So I'm just going to kind of throw these out there. So some scenarios that you need to let the carrier know. So we had, a severance agreement, maternity, paternity leave, employee requests a leave of absence, COVID layoff, not actively work. So these are all sorts of things that you have to let the carrier know. You have to let the carrier be in the loop, because that potential is there for, if the carrier doesn't know and something happens to the employee, but they're not active on your plan, a claim can get declined. Okay. So it's a very simple thing. We came across this, Michael, and you can add to this a bit of, when with COVID, all the layoffs, then people need to remember to add their employees back on to the plan.
Wow.
Yeah, and there's a number of scenarios, Matt, and you touched on the layoff for sure, but where an employee is still deemed to be employed, right? So a layoff situation, a leave of absence, maternity, paternity, those are all situations where an employee is still eligible as per the terms of the contract and can continue benefits for a specific period of time. So you're right. When COVID struck back in March, April of 2020, we saw hotels, we saw restaurants, we saw retail approach us with temporary layoffs, which was excellent, because we do need to know. The contracts will allow for an individual that has been laid off to continue health and dental benefits indefinitely, provided that premium is still being paid to the insurer. So that's great. And Saskatchewan businesses were exceptional in allowing their employees to continue, their valuable health, drugs, dental. So that was great to see. Life coverages specific to life insurance, accidental death and dismemberment, dependent life, critical condition. Those benefits can be continued up to 6 months in the event of a temporary layoff. And short and long-term disability, depending upon who your insurer is, could be anywhere from about 30 to 60 days. So that was great. But again, keeping in mind that if you didn't advise the insurer that you had a temporary layoff and you were still you were still deducting short and long-term disability benefits, for example, for your employees when your contract stated that they only had access to those benefits for 30 days, that could create a bit of an issue between the employer and the employee.
Oh, absolutely. Another big one that we've come across is severance. With a severance, you need to talk to the insurance company beforehand. A situation that we had is we found out that there is a severance package agreed to from the employer and the employee, and the employee hadn't been actively at work for a couple of years by this point. So if that employee was like, we're still paying for disability, still paying for life, all that kind of stuff. But if something had actually happened, that employee would not have been eligible for that disability because they haven't been actively at work for a couple of years. So luckily in that scenario, we were able to go back and work with the carrier and get it fixed. But it's still a key thing. You have to talk to the insurance company beforehand, or at least talk to the broker and make sure that you can iron out all the details. Because part of what we do and what Michael does, and I'm sure Renee and Danielle as well, is we're trying to think of what could happen. Yeah. Right? Always, what is the protecting our clients? What is the potential worst case scenario from here? And if we don't know, there's really not a lot we can do.
Absolutely. Reach out to us if ever you have any doubt, if there's anything that with your gut reaction or in the absence of data, we talk about this all the time, do reach out to us. We'll make sure that the carrier knows.
Yeah, exactly. And that, again, just really highlights the value of a broker and in partnership with their client and the insurer. The insurer it should be the one that's assuming risk, in a group benefit plan relationship. It should not be the policyholder or the company. So today, again, an excellent topic, and we've already talked through a lot here in 15 minutes, but these are all great ways to help reduce risk, liability for your company and transfer that on to the insurer.
Mm-hmm. And a key thing with all of this, we're talking about extension of benefits policies, all that kind of stuff, is make sure you have it in writing.
In writing.
So with a cost share, you're paying a portion, your employees are paying a portion. If you have an employee go off on long-term disability, they can be off until they're 65. How long are you keeping them on the plan? Right? This is something that has to be decided beforehand, and so that everyone is on the same page. So for example, if you have 2 employees in a van driving to the work site, one you're going to fire as soon as they get back, and the other one's going to be your succession plan, they still have to be treated equally. You can't make ad hoc decisions of you get disability, but you don't. Right?
Yeah. We talk about this a lot, and we see the price of compassion can be extremely high, but it can also sink your business.
It can, yeah. Another big one, conversion options. So for those who don't know, conversion, you have 60 days to roll your health and dental benefits when you retire or terminate or that kind of thing into a personal plan from your group plan, and 30 days typically for your life insurance. The key part is within those time windows. If it's beyond that 30 days or that 60 days, there could be full medical questions, and the person, any drugs that they need or any services that they need could potentially be declined.
Insurability is everything, especially nowadays. So if you're facing a situation whereby you do have that health and dental conversion coming up for an employee who is leaving due to, it could be they're retiring, any type of situation, we do get notifications of the layoffs. Do reach out to us. Danielle and I do health and dental conversions here. We work closely with Blue Cross and the other carriers as well, and we'll help you out with that.
Another story, not to be total doom and gloom, but this is the whole point of this is to make sure you guys have some takeaways, some things to think about. I had a client that the plan administrator didn't tell the employee who was retiring about conversion, because like a lot of you, I can imagine you only put on your benefits hat a couple times a year when you talk to us, so you don't think about it. So she didn't tell the employee about his conversion options. Right before he retired, he got 90 days worth of drugs.
Oh,
You can sort of see where this is going. And then after, he waited another 90 days, went, oh man, I need some more. Went to apply for insurance, got declined coverage for the medications he was on. And his lawyer reached out because the plan administrator forgot to tell him. Luckily, in this case, we had a signed policies and procedures document that included this extension of benefits policies we talked about. And it showed, and I'm empathetic to the employee, but it did show that he signed an initial, that he understood he only had a certain amount of time, and the issue kind of disappeared from there. Mike, I'm sure you've seen stories like that too.
Yeah, and it reminds me of a quote, Matt and Renee, and I meant to say this in the opening, but it was a Benjamin Franklin quote, and I hope I don't butcher it here, but it says if you fail to plan, you plan to fail, right? And that's just that really highlights our conversation. And the key thing is that without a doubt there are conversion opportunities available for group life. For, like you mentioned, health, drug, dental, travel benefits, without any medical underwriting, provided it's done within that 31 days, right? So we certainly want to, and again, it's not the plan administrator's, job to ensure that the employee converts, but it's certainly, within their responsibilities to highlight that option's available to them, right? So, by working with your broker, Uyghurs Financial and Benefits, those employees that certainly could make use of those benefits after they've terminated employment with the employer. It's great to have those options available, that they can take those personal policies with them into their future years.
Right. So we ideally want to keep it around 30 minutes and have a little questions. So we'll go a little bit faster on this slide to make sure there's room for questions if anybody wants them. Plan design. So there's still liability on there, and so more year after year as these high cost medications are starting to go through plans. If you have, gone are the days of 100% unlimited plans.
absolutely.
They can be so dangerous. If $150,000 to $200,000 drug goes through your plan, that's catastrophic. I mean, health and dental is calculated at renewal time by dollars in, dollars out, just looking at the math. So if there's 200 grand already going out on one drug, let alone everything else, there is a big reconciliation come renewal time, right, Michael?
Yeah, and it's imperative we talk about drugs, as you've mentioned, Matt. across our block of business, out of every dollar that we receive in premium from the employer, about 70 cents of that, and I'm talking specific to the health benefits. So out of every dollar of premium we receive, about 70 cents of that gets paid out in a drug claim. So, for those listening today, you can easily go into your renewal and your claims experience and take your drugs, divided by your total health claims, and and see if your organization aligns with that comment or not. But you're right, in terms of, and we still certainly see some unlimited plans out there. So if you do have an unlimited plan, check with your broker to ensure that you have what we refer to as stop loss as a component. So stop loss just simply is a threshold. So it's $10,000, $15,000, where if an employee, and we do have employees throughout Saskatchewan on medication in the hundreds of thousands of dollars, that is a fact. So, for example, if an employee or a family member is diagnosed with a condition, their drug is $100,000, only the first $10,000 of that would appear in your claims experience. You've transferred the $90,000 to the insurer, right? So stop loss is critical if you have an unlimited drug plan.
Okay.
So another big one, special support program. I know Blue Cross, you have integration with the special support program. So if those people don't know what it is, it's essentially when you've reached a certain threshold of drug claims, the government steps in and starts paying a higher portion, and it's an income tested benefit. So how do you guys go about the special support program, Mike?
Yeah, so we have what we refer to as a minimum and a maximum threshold match. So and that is assigned by the plan administrator in conversation with their broker. So, for example, once a family or an individual incurs $1,000 of drug claims, they receive a letter from Saskatchewan Blue Cross encouraging their family to apply to the Ministry of Health and their special support program. It's an income tested in relation to your drug claims. So the ministry will either approve or deny the request. We just simply need a copy of the approval or denial letter. And then what happens is if the family does have high drug costs in relation to their income, the government will help to offset some of those costs. So they may say, okay, once your family reaches, $2,500 in drugs, we will cover 30% of drugs incurred over that $2,500 for your family. So you can see from the plan administrator's standpoint, those drug claims that are now being covered by the province are no longer appearing in your group's renewal, right? So you're saving costs for all employees by integrating with the special support program. We also have a maximum threshold. So if the minimum was 1,000, our maximum could be 2,000. If the family did not provide a copy of the approval or denial letter by the time they submitted $2,000, then we would temporarily suspend their claims until we receive those letters. So again, being accountable to the employer and the rest of the employees to ensure that drug claims that can be covered by the government are being covered by the government. Absolutely.
And the letter has two sides to it. There's one that you fill out if you want to apply every year, or you can flip it over. And the other side gives Sask Health access to your income tax, essentially. And so they'll automatically do it for you every year, so that the process can be quite simple. The last thing we'll sort of leave you on is the mental health components of employee benefits plans and employee and family assistance programs. So our poll, which still isn't working, but we'll put it out there. So maybe in the chat, everyone, I'd like to see your what you say in the chat here. So what do you think the typical usage of an EAP, so employee and family assistance program, that's counseling over the phone and video, in person, all that kind of stuff. What do you think the typical usage is? Here's some options: 6%, 25%, 54%, or 81%.
Lots of 6% coming up.
If you're from Blue Cross and you're answering, don't cheat.
No cheating to my colleagues.
Couple sixes, some 54, 81. Yeah, you think 81, especially right now?
Absolutely. The effects of COVID, and I think, Mike, you probably agree with this. Wow, there must be an uptick for the last 6 months, would you say?
Yeah, we certainly are seeing an uptake in employee family assistance programs, and more importantly, employers that are wanting to do everything they can beyond the traditional group benefit plan to provide. The traditional group benefit plan does a great job in covering physical physical ailments. But it can do more in terms of mental and holistic and overall well-being. So we certainly have seen the addition of registered social workers, counselors, and implementation of an employee family assistance program since March of 2020, all understanding that the employee family assistance program is confidential. Right, so the employer, the broker, the carrier is not aware of appointments, conversations that are being had to help the employee and or their family members, deal with some of the life challenges many of us, throughout Saskatchewan have been faced in almost coming up to a year.
Oh yeah, exactly. And Andrea brought a good point in the chat. Experience with this exact situation, as well as substance abuse issues in safety-sensitive positions. Substance abuse is one that commonly we see comes up in a lot of reporting for employees and family assistance programs. And really, if you're present at work, the term is presenteeism. So you're at work, but just in person, right? You're thinking about other things, whether you're having financial issues, you're drinking, like there's a number of things that this can help your employees help themselves.
Yeah, absolutely. Thank you, Andrea, for that comment. Absolutely, we see this all the time. Thank you.
Yeah, and the answer to the poll is 6%.
6%, and so it's, I would say, largely unutilized.
Yeah, it's incredibly. I mean, there is still a stigma to mental health and reaching out and getting help, even though it is totally anonymous. I have some clients that have used it as high as 60 to 80% when something has happened and that kind of stuff. So just having those resources there for your employees can be huge, to have them reach out, because really it does benefit you in the end if you have employees who are active and present at work and doing their best. Wonderful. So we're at just over 31 minutes here. So are there any questions? We'll let it kind of marinate here.
Huge thanks to you, Mike from Blue Cross. You are an absolute wealth of knowledge. I know we could probably do 6-part series on employer-led liability. I know we get questions all the time. Matt, thank you for your examples as well. For those of you that, again, are new to us, please reach out for any questions that you have. That's what we're here for, to educate and inform. If you found this session valuable, please leave us a Google review. We would love it. If you'd like to see more of these types of topics and more of this kind of style covered with our guests, please reach out as well. Thank you so much.
And there will be a survey sent out, so please let us know your feedback, like Renee said. And the replay will be available on YouTube as soon as we can edit down and get it up. So awesome. Thanks very much for joining us, everyone. Have a wonderful
Happy
rest
New
of your
Year.
week.
Thank you. Thanks for having me.
Thank you, Matt. Thank you very much. See you, Mike.